Hi class, this is Dr. Pape, and today we're going to talk about health promotion, disease prevention, and family and community health. Today it is even more important than ever to be concerned about health promotion and disease prevention because people lead more sedentary lives. So our objectives are to talk about concepts and models of health, wellness, disease, and illness, to consider acute illness versus chronic, discuss factors that play a role in health equity and health disparities, talk about basic human needs, self-concept, influence health, how they influence health and illness, and summarize the role of the nurse in promoting health and preventing illness, as well as addressing disparities in healthcare. Definitions of what makes up a family differ depending upon the first person you're talking to. But typically, a family is a group of people who live together and depend on one another for physical, emotional, and financial support. A family will look different depending on who is describing it. But we usually have the nuclear family, which is the traditional family with two parents and their children. The extended family would be aunts, uncles, and grandparents. The blended family are two parents and their unrelated children from previous relationships. And the single-parent family, who is maybe a person who is separated, divorced, widowed, or never married and cares for a child or children. This is Maslow's hierarchy of human needs, which are common to all people, and meeting these needs is essential for the health and survival of all people. We first must have food and water, be able to sleep and breathe. Without that, we can't talk about any other needs that are higher level. A person can meet some needs independently, but most require relationships and interactions with others for partial or complete fulfillment. Meeting these basic needs restores health, and fulfillment takes priority over other satisfactions when unmet. A person feels something is missing when a need is unmet, and they will seek out a way to resolve that unmet need. Likewise, a person feels satisfied when a need is met. So back to physiologic needs. These are those that include oxygen, water, food, elimination, temperature, sexuality, physical activity, and of course rest. These needs must be met at least minimally to maintain life. They're the most basic. Most healthy people meet their physiologic needs through self-care. However, meeting physiological needs can be a major part of nursing care for caring for young, old, disabled, and ill people who do require assistance. Nurses evaluate the patient's oxygen needs by assessing skin color, vital signs, anxiety levels, responses to activity, restlessness, and mental responsiveness. We also must consider the balance between intake and elimination of fluids, which is essential to life. Second in priority are safety and security needs, being protected from potential or actual harm. Let's think about examples of interventions to meet these needs. Using hand hygiene to prevent infection and its spread. Using proper isolation protective wear. Using all equipment properly, including proper lifting techniques. Administering medications skillfully and accurately, and preventing the patient from falls are just a few. The third priority need is called the higher level needs, including understanding and acceptance of others, and giving and receiving love. The feeling of belonging to groups such as families, peer groups, friends, a neighborhood, and a community, or even an organization, such as a college, are important. People have a need for self-esteem, confidence, a sense of achievement, respect for others, and respect by others. Without these, illness can ensue. A person who has been abused early in life may have difficulty with esteem needs. Unmet needs produce loneliness, depression, and isolation. Let's think of examples of interventions to meet these needs. We can include family and friends in care of a patient, use self-care measures in order to better care for others, establishing trusting nurse-patient relationship, and keeping our promises to patients. Also, being dependable to our peers as well. Next in the hierarchy are self-esteem needs. This is the need for a person to feel good about themselves, to feel pride and a sense of accomplishment, and to believe that others also respect and appreciate their accomplishments. Positive self-esteem facilitates the person's confidence and independence. So let's think of factors that affect self-esteem. Role changes when a person feels a sense of loss can affect their ability to care for themselves, and they must then depend on grown children or friends. Body image changes can occur when the person experiences a colostomy or amputation, for example. Treatments by others in their world can affect a person's self-esteem. You know, there's a saying that we teach people how we want to be treated by our own actions or words. However, this does not always apply, especially to our patients. We owe them a sense of respect regardless of their current condition. This reminds me of a time when I met a patient in the local department store who remembered me. He said he would never forget me and my caring attitude during a difficult time. These are the types of rewards that we as nurses receive. Self-actualization needs are demonstrated as signs of maturity. This includes the acceptance of not only oneself, but that of others, just as they are, and with all their failures and weaknesses. There should be a focus on interest on problem solving outside of oneself. Signs of maturity include the ability to be objective, to find a sense of happiness and have affection for others. Respect for all people is important, as well as the ability to discriminate between good and evil in life. Self-actualization occurs when a person reaches maturity, has met the previous belonging needs, is able to accept others as they are, is not prejudiced, is creative, spontaneous, and able to solve problems, as well as being a good and moral person. So now we move to the topic of community health. A community is a specific population or group of people who live in the same geographic area or city under similar regulations, and they can have the very common values, interests, and needs. Today, Americans die younger and have a consistent pattern of poor health and death. They suffer from more illness and injuries compared to other wealthy nations in the world. Designing healthier communities is important. So there are basically a healthy community offers access to healthcare services for all members of the society, including both treatment for illness and activities to promote health. Has roads, schools, playgrounds, and other services to meet needs of people. Maintains a safe and healthy environment, including safe housing. The healthcare structure of a community directly affects the health of the people living within it. The size and location of the community determine what health services are available. For example, urban residents may have public transportation to healthcare providers, whereas rural residents may need to travel long distances in their own car. County and state funding for community health services also determine the type and number of available healthcare institutions and facilities. So now we focus on the definitions of health states. Health is considered complete physical, mental, and social well-being. It's not merely the absence of disease. The health of the public is measured globally by morbidity, which is how frequently a disease occurs, and mortality, the number of deaths resulting from a disease. Each person defines health in terms of his or her own values and beliefs. Health integrates all the human dimensions: spiritual, intellectual, emotional, socio-cultural, and environmental. Illness is considered the unique response of a person to a disease. It is abnormal, involving the changed level of functioning. Disease is a medical term, and a disease is diagnosed, and treatment is prescribed. It's important for nurses to remember that a person may have an illness or injury but still achieve maximum functioning and consider himself or herself to be healthy. So wellness is an active state of being healthy by living a lifestyle promoting good physical, mental, and emotional health. Generally, an acute illness has a rapid onset of symptoms and lasts only a short time. Some acute illnesses can be life-threatening, but most are simple, and such as the common cold or diarrhea don't usually require medical treatment. If treatment is required, some medications can be taken, such as an antibiotic for pneumonia, surgical procedures such as appendectomy, or another medical treatment will return the person to normal functioning. Chronic illness is a broad term that usually includes a number of physical or mental alterations in health. It has a slow onset with periods of remission and exacerbation. Remission is when the disease is still present but the person does not experience symptoms. Exacerbation is when the symptoms reappear. An example of this could be asthma. Examples of other chronic illnesses include diabetes mellitus, COPD, arthritis, or kidney disease. Chronic illnesses involve a permanent change, and it is irreversible. It requires special patient education for rehabilitation and a long period of care or support. We have what's called stages of illness behavior. So in stage 1, the person starts experiencing symptoms. They may have one or more symptoms. Pain is a common symptom. Other symptoms could include a rash, a fever, nosebleed or bleeding somewhere, or a cough. In stage 2, the person starts to assume the sick role. They now define themselves as sick. They'll seek the support or the viewpoint of other people. They'll give up normal activities and assume the sick role. Most of the time, they'll focus on their symptoms and bodily functions. However, illness will become what we might refer as legitimate when they go to the doctor and get a diagnosis. In the case of COVID-19, we see this playing out as people who are sick want to be tested in order to validate that they have the illness. Then in stage 3, the person will assume a dependent role and decides to accept their diagnosis generally. They might even seek a second opinion. Then in stage 4, they begin to recover and rehabilitate. They may enter the hospital to recover and rehabilitate, or they may do this at home. So they give up the dependent role finally and resume normal activities and responsibilities. There are various factors that influence health disparities, but first we need to look at some definitions. Healthy People 2020 defines health equity as the attainment of the highest level of health for all people. Today, there continues to be disparities that lead to different health outcomes among different people. So a health disparity is defined as a particular type of health difference that's closely linked to social, economic, or environmental disadvantages. Health disparities are influenced by many factors, including the person's race, ethnicity, their level of poverty, biological sex, being male or female, age, mental health, educational level, and disabilities. Perhaps their sexual orientation can affect their health disparity, health insurance, of course, and access to healthcare facilities. There needs to be much attention given to the root causes of health inequities and health disparities, which include helping groups that have experienced major obstacles to health due to socioeconomic disadvantages and injustices. We need to promote equal opportunities for all people to be healthy and distribute economic resources and health resources that will improve health for everyone. The factors that influence a person's health or illness status do include their health beliefs and health practices as well. Here is an example of the benefits of walking in this picture that one person may use as their health practice. Walking improves one's mood, lowers blood pressure and cardiac risks, relieves back pain, tightens muscles, helps keep a balanced diet, a balanced weight, lowers risks of blood clots, and keeps joints healthy. Another person may not engage in walking as a health benefit. The nurse's role is in assessing a person's activities and beliefs, and offering education about health practices to benefit that specific patient. A risk factor is something that increases a person's chance for illness or injury. Like other aspects of health, risk factors are often interconnected. We further define risk factors as modifiable, things a person can change, and non-modifiable. Nearly 2/3 of the difference in death rates in the United States is explained by differences in modifiable risks. For example, tobacco use, being overweight, having high cholesterol, physical inactivity, obesity, and inactivity tend to lead to diabetes. Non-modifiable risk factors include things like a person's family history of cancer and heart disease. But as a person's number of risk factors increases, so does the possibility of illness. For example, an overweight nurse under pressure to manage care of multiple nursing units may smoke and drink alcohol to excess in order to cope. These factors, combined with the family history of heart disease, places this person at higher risk of illness. So this leads to health promotion and disease prevention and the three areas that we consider: primary, secondary, and tertiary. Primary prevention is directed toward preventing disease or injury. For example, getting immunizations, using family planning services, poison control, and accident prevention education. Secondary prevention focuses on screening for early detection of disease. For example, medical screenings such as dental and vision examinations, colon cancer screening, mammography, and hearing testing. Tertiary begins after an illness is diagnosed and treated, with the goal of reducing disability. Primarily, this is rehabilitative. For example, teaching a patient with diabetes how to recognize and prevent complications. Using physical therapy to prevent contractures in a patient who has had stroke or spinal cord injury. And referring a woman to a support group after removal of a breast because of cancer. We move on to models of health behavior. The health illness continuum model is one way to look at a person's level of health. The model views health as a constantly changing state with high levels of wellness and death at opposite ends, or on a continuum. This illustrates an ever-changing state of health as the person adjusts to changes in their state of well-being. For example, patients with cancer can view themselves at different points on the continuum, depending on how well they believe they are functioning with the illness at that point in time. This leads us to the health belief model or theory that's concerned with what people perceive to be true about themselves and their health. The model is based on three components: perceived susceptibility to a disease, perceived seriousness of a disease, perceived benefits of taking action. For example, in the case of COVID-19, one person might feel that since they are young, they are not susceptible, although this is proving to be untrue. But still, they would understand the seriousness of the disease and the need to follow regulations to prevent its spread to others. Modifying variables include things that support actions such as the advice of experts, mass media, campaigns, literature, or appointment reminder telephone calls. The likelihood of taking a recommendation for preventing health problems is a composite of an individual's perceptions. Self-efficacy is one's own belief in the ability to reach goals and complete tasks. It's a strong influence on a person's health choices and health behaviors. However, teaching health promotion activities is ineffective unless the person believes that they are important and necessary. This brings us to Pender's health promotion model, which includes one's beliefs and perceived barriers to promoting their health. It can include situational influences. For example, an overweight person probably knows obesity is unhealthy. They have attempted to lose weight several times with no success. They understand the benefit of losing weight would be improved mobility, increased energy, and decreased cardiovascular risk. However, the barrier is a busy lifestyle, which could be the problem that they're facing. 3 additional variables in the health belief model in the health promotion model include activity, commitment to a plan of action, and immediate competing demands and preferences. Proclasta and DiClemente's trans-theoretical model of behavioral change is perhaps one of my favorites. It was originally designed for helping people with addictions. Let's think about the communication and interventions nurses might use in each of these stages to help someone change. Pre-contemplation is the time when the person is not even thinking about trying to change their behavior. Other people see the problem. For example, maybe they're a heavy smoker or they're heavy in weight. But the person does not seek help. They don't see it. We can validate the person's lack of readiness to change by encouraging self-exploration or planting a seed. Contemplation, then, is when people are still undecided, but they do consider the need for changing their behavior. For example, with smoking, here's where education is important. Nurses can teach the patients about smoking cessation and its importance. We can make clear that the decision, though, is theirs. Then the stage of determination is when commitment ends in action. We help the person here by encouraging the use of realistic plans and using small steps, and finding creative ways to address any difficulties. Then finally, in action, they've implemented the plan, they've begun to change, and have achieved some success. Other people start to become supporters. They see the person as losing weight, they see the person as not smoking as much and are commenting. Then maintenance, the person has accomplished the change. The person feels more comfortable. Relapse is still a possibility, but they have sustained the behavior for at least 6 months. Then the termination stage. This is the 6th stage that has been added in recent years. It includes no longer having any temptation. The person feels 100% sure that they can maintain the new behavior and they are at peace with themselves and the former problem. It is as if they never had the habit in the first place.